Hi, I am Dr. Mollie Meek. I'm an interventional radiologist. This is a different kind of specialist than the rest of the urologists here at Arkansas Urology. I joined the group to provide a very specialized, minimally invasive treatment that can really help improve your quality of life. I provide minimally invasive procedures, usually entered from an artery or a vein. Some examples of this are prostate artery embolization, uterine artery embolization for fibroids, varicocele embolization, and pelvic congestion syndrome treatment for women. Prostate artery embolization is a minimally invasive procedure that is designed to shrink your prostate. Your prostate sits at the bottom of your bladder, and the tube that drains your bladder runs right through the middle of your prostate. You can see here on this picture, this is your prostate and this is your bladder, and the tube goes right through the middle of your prostate. As men get older, their prostates get larger and the gland gets bigger, and it pinches the tube that drains. This causes symptoms such as increased frequency. You have to get up and go to the bathroom every 1 to 2 hours. You don't feel like you empty your bladder all the way. People get up frequently at night, 2, 3, 4 times at night, which is very disruptive to sleep, and or your stream stops and starts and stops and starts. Some people notice a change in the strength of their stream over time as their prostate grows and this narrowing gets tighter. In severe situations, patients can end up with a catheter that goes through their penis and into their bladder to drain the urine past the obstruction caused by the prostate. At Arkansas Urology, we have many different types of procedures designed to reduce the size of your prostate and improve your urinary symptoms. Prostate artery embolization is just one of many choices available to you here. To do the procedure, we enter the artery in your groin right at the fold of your leg and lower pelvis. We go in the artery and we drive our little tiny devices all the way around until we get into the arteries that feed your prostate. We use an X-ray camera and X-ray dye so that we can see where the arteries go and where we are delivering our treatment. When we get our catheter into just a perfect location and everything looks safe, then we put little tiny beads into the arteries. It's hard to see in this video, but there are little tiny beads layered in here. If I shake them up, you'll see them enter suspension, and then they'll layer back out again. These are actually bigger than the ones that we use inside the artery. When we put the beads into the artery, it acts like sludge and it slows down the blood flow to your prostate. We don't kill your entire prostate. We don't completely cut off all the blood supply. We just slow the blood flow down. This causes your prostate to sort of go on a diet, and it shrinks over time. Common questions regarding prostate artery embolization are, what does my day look like for the procedure? So you come in the morning. It takes about an hour to do your pre-op. We insert a catheter into your bladder. We start an IV, and we give you some medicines. We give you some antibiotics to help reduce the chance of infection, and we give you some relaxing medicines to help you feel comfortable while you're laying in the procedure room. Then we take you into the procedure room where you lay on a big flat table, and a big X-ray camera comes over your abdomen. We clean your groins, and then we enter the artery and we do the procedure. The procedure takes 1 to 2 hours depending on the patient's specific anatomy and characteristics. And then when we're all done, you go back into the recovery room where you'll lay flat for another 1 to 2 hours. During this time, we provide plenty of relaxing medicine. Some patients go to sleep, some patients just feel relaxed. We have an excellent group of nurses and techs that will be with you the whole time. There are some possible complications from the procedure. They are very infrequent, but definitely a possibility. One is that you can have bleeding from where we enter the artery in your groin. Another is that we could damage the arteries as we drive our little catheters and wires through your body. There is a very small chance that we could damage anything near your prostate. Your bladder or your rectum, for example, could get injured. This is very infrequent, but definitely a possibility. One of the common questions that patients ask when trying to decide which prostate procedure to have is, what are the sexual side effects from a prostate artery embolization? There are very, very minimal risk of sexual side effects from this procedure. If you're a patient with a catheter and your desire is to get your long-term indwelling catheter out, this can take significant amount of time. The way we usually do this is we will change your catheter on the day of your procedure. You will keep your catheter for 1 month, and then we will do our first voiding trial. Some patients have a successful voiding trial and are catheter free at 1 month, but some patients require longer. It's important to remember that it takes time for your prostate to shrink in size, and the longer we give it and the more time it has, the more likely that tube in the middle is to open up and allow you better urinary drainage. The goal of the prostate artery embolization is to shrink your prostate. And when your prostate shrinks, it opens the tube in the middle of your prostate, which lets the urine drain from your bladder better. This takes time. It doesn't happen overnight. Your body needs time to allow your prostate to shrink, and we expect symptoms to continue to improve for 3 to 6 months after the procedure. Some patients have very, very large prostates, and they might need multiple embolization procedures to really get the prostate down in size to where their symptoms are significantly better. This isn't super common, but it is a possibility, especially if you're one of those patients that has a prostate over, say, 100 grams. There are some common symptoms that men may experience after a prostate artery embolization. One of the most common things that people have happen is that they notice blood in their urine. This can last for 1 to 2 weeks after the procedure. Sometimes people even notice blood in their semen or blood in their bowel movements. This generally only lasts a few days, but it's definitely noticeable when it happens. Very frequently, men say they report a burning sensation when they urinate for the first few days after the procedure. And then sometimes people experience bladder spasms. A bladder spasm is a quick contraction of your bladder muscle, and it can sometimes make urine leak out, or if you have a catheter, it can make urine leak around the catheter. They're sometimes painful and they're sometimes not painful. We give patients medicines for bladder spasms and for the burning pain that you may experience following the procedure.